Did you know that a stroke can happen to anyone at any time? Each year, nearly 800,000 people experience a stroke. A cerebrovascular accident, otherwise known as a stroke, is a sudden loss of function of the brain that can be life-threatening and cause severe damage. According to the National Stroke Association website, strokes are the 5th leading cause of death in the United States. I am here today to inform you of the signs, symptoms, and treatment plans for strokes. There are numerous things that you need to know to be able to recognize and treat a stroke. The first thing to note is that there are 2 different kinds of strokes, ischemic and hemorrhagic. Ischemic strokes occur when arteries to the brain become obstructed or blocked. This causes severely reduced blood flow. Mayo Clinic's website confirms that 80% of all strokes are ischemic. Hemorrhagic strokes occur when a blood vessel in the brain leaks or bursts. Brain hemorrhages, or brain bleeds, can result from high blood pressure, weak spots in the vessel walls, or head injuries. Both can cause lifelong damage. Do you know how important it is to know the signs and symptoms of a stroke? The acronym to remember is FAST, F-A-S-T. F stands for face. Ask the person to smile. Do you notice one side of their face drooping? A stands for arms. Ask the person to raise their arms and see if you notice if one arm isn't rising or is not rising as high. S stands for speech. Is the person's speech slurred or strange? T stands for time. After observing any of these signs, it is important to immediately call 911. Every minute counts. The longer you wait, the more severe the damage could be. Strokes can affect speaking and understanding, cause paralysis, vision damage, headaches, and trouble with walking. During or after a stroke, most people have extreme dizziness, possible vomiting, or loss of coordination. Strokes need to be treated as quickly as possible to get the best results. And always remember to act fast. If you or a loved one have experienced a stroke, it is important to know all your treatment options. The first thing the doctor will do is determine the type of stroke you had and the areas of the brain that have been affected. This may be done by physical assessment, blood tests, CT or MRI scans, and ultrasounds. Depending on the type and the severity of the stroke, you could need anything from medicine to surgery. Some strokes cause aphasia. Aphasia is the inability to express or understand speech. This would require a speech pathologist for rehabilitation. Other strokes cause paralysis in the face, arms, or legs. This would require a physical therapist for rehabilitation. This is only the beginning of the amount of doctors you might need for recovery. Stroke recovery is a lifelong process, so it is important to know your options. Every stroke is different, so every treatment plan is also different. There are also great support groups and helplines at the American Stroke Association, National Stroke Association, and Mayo Clinic websites. It is always good to listen to the doctor's recommendations to find treatment programs that fit your lifestyle the best. There are numerous people that want to support and help stroke victims. It is extremely important to know the signs, symptoms, and treatment plans for strokes. You never know when you might be the one to recognize a stroke and help that person's life. Knowing treatment options can be tremendous help in the recovery process. Now that you know the acronym FAST, you can recognize a stroke, call 911, and begin that person's road to recovery. Thank you.
I'm assuming this is the important speech. I'm assuming this is the